Good afternoon, Van Mossies. Let's begin the warm-up session. What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
How do you deal with someone who isn't satisfied with your patient care?
When faced with a dissatisfied patient, I assess the issue, determine if it's something within my control to correct, address their concerns, answer their questions, and collaborate with colleagues for alternative solutions if necessary. My goal is to accommodate the patient without compromising their care.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
Your preparation time is over. Please start your OET speaking role play.
Hello, I'm Nurse Van Mossies. I can see you're not feeling your best today. Thank you for coming in. Could you tell me about what's brought you here?
Hi, Nurse Van. I've been feeling unwell for a couple of days. My nose is constantly blocked, I feel a bit feverish, and I've been sneezing a lot. I suspect it could be the flu, and I'd like some advice on how to manage it.
I'm sorry to hear that you've been feeling this way. Before further proceedings, may I know your name please?
My name is Mihira.
Mihira, I understand how uncomfortable those symptoms can be. Let's start by getting a clearer picture of what you're experiencing so I can guide you appropriately. Could you tell me more about your symptoms?
It's mostly the congestion, but my nose does run occasionally. My throat is a little scratchy, but it's not painful. I don't have any major headaches, just a mild one now and then. I feel feverish, but I haven't checked my temperature. No chills or body aches, though.
Thank you for sharing that, Mihira. Based on what you've described, it seems like you may be experiencing a common cold. Let me explain a little about this condition. The common cold typically includes milder symptoms such as a runny or blocked nose, sneezing, a scratchy or sore throat, and possibly a low-grade fever or none at all. On the other hand, the flu often causes more intense symptoms like high fever, chills, body aches, and significant fatigue, which don't seem to match your current condition. Would you like me to go over how you can relieve your symptoms and start feeling better?
Yes, that would be great. I just want to feel normal again.
Of course, Mihira. The good news is that the common cold is usually temporary and resolves on its own within about a week. In the meantime, there are several ways to ease your symptoms. Staying hydrated is very important, so try to drink plenty of water or warm fluids like herbal teas. Using a saline nasal spray or a rinse can help relieve congestion, and a humidifier at home might make breathing easier. It's also best to avoid irritants such as smoke or strong perfumes. Over-the-counter medications like decongestants or antihistamines can help manage specific symptoms, but you should always read the instructions carefully and ask a pharmacist if you're unsure about which to choose. Would you like me to explain any of these options in more detail?
Thank you, that sounds manageable. Could I get a prescription for something stronger, just in case this gets worse?
I completely understand your concern, Mihira. However, for the common cold, prescription medications like antibiotics are not necessary because the condition is caused by a virus, and antibiotics are only effective against bacterial infections. My role here is to provide guidance on self-care and over-the-counter remedies, which are usually enough for this kind of illness. Do you have any concerns or questions?
That makes sense. I'll try the suggestions you mentioned and see how it goes.
That's a good plan, Mihira. Please remember that the common cold is self-limiting, meaning it tends to clear up on its own without causing any serious harm. It can just feel a bit unpleasant while it lasts. If you're still feeling unwell after a week or notice new symptoms like a high fever, persistent pain, or worsening congestion, make sure to consult your GP to rule out any underlying conditions. In the meantime, take care of yourself and rest as much as you can. Is there anything else you'd like to ask or clarify before we finish?
No, I think that covers everything. Thank you so much for your help, Nurse Van.
You're very welcome, Mihira. Take care, and I hope you feel better soon. If you need further advice, don't hesitate to come back.